Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Common cold. Introduction. A cold is a common infection that can be caused by over 200 different viruses. Symptoms often include scratchy throat, runny nose, and sneezing. The common cold is usually mild, but it is one of the leading causes of missed school and work. Symptoms typically last 1 or 2 weeks. This program explains the common cold, including information about symptoms, causes, treatment, and prevention. Causes. The common cold is caused by a virus. More than 200 different viruses can cause cold symptoms. Some produce serious illnesses. Others produce mild infections in adults but can lead to severe lung infections in young children. You can get infected by cold viruses by either inhaling drops of mucus full of cold viruses from the air, touching your skin or surfaces such as office phones that have cold viruses on them, and then touching your eyes, nose, or mouth. Most colds happen during the fall and winter. This may relate to the opening of schools and the start of cold weather, which cause people to spend more time indoors. Close contact with others increases the chances that viruses will spread from person to person. Seasonal changes in humidity also may affect the number of colds people get. The most common cold-causing viruses survive better during colder months of the year when humidity is low. The lining of the nose is also drier when the weather is cold, so people can catch a cold more easily. Symptoms. Symptoms of the common cold often include cough, difficulty breathing through your nose, headache, mucus buildup in your nose, sinus pain, sneezing, sore throat, tiredness. These symptoms usually begin 2 to 3 days after infection. Fever is uncommon in adults with a cold. It is often found in children with colds. Contact your healthcare provider if you or your child has a fever above 100.4 degrees Fahrenheit. Immediately see a healthcare provider if a child's fever is 102 degrees Fahrenheit or higher. Cold symptoms can last from 2 to 14 days. Most people recover in 7 to 10 days. If your symptoms return often or last much longer than 2 weeks, you might have something other than a cold. High fever, swollen glands, severe sinus pain, and a cough that produces mucus may be signs that you have a complication or more serious illness. Contact your healthcare provider if you have one of these signs or symptoms. Talk to a healthcare provider if you have any of the following signs and symptoms. Worsening cough when other symptoms are improving. Ear pain. High fever. Severe cold symptoms. Sinus headache. Worsening of a chronic lung problem such as asthma. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. When to see a healthcare provider. In most cases, you don't need to see your healthcare provider when you have a cold or the flu. Viral infections like the cold or flu cannot be cured with medicine. However, some symptoms are signs of a more serious problem. The following section describes symptoms that should be discussed with a healthcare provider. Children should see a healthcare provider if they have bluish skin color, ear ache or drainage from the ear, fever above 102 degrees Fahrenheit, fever lasting more than 3 days, symptoms lasting more than 10 days, trouble breathing, fast breathing, or wheezing. Other signs that children should see a healthcare provider include changes in mental state, such as difficulty waking up, irritability, or seizures, flu-like symptoms that come back with fever and a cough that is worse than before, vomiting or abdominal pain, worsening of diabetes, heart disease, or other chronic condition. Adults should see a healthcare provider if they have a prolonged fever above 102 degrees Fahrenheit with fatigue and body aches, pain or pressure in the chest, symptoms that are getting worse, not better, symptoms that last longer than 10 days, shortness of breath or trouble breathing. Other signs that adults should see a healthcare provider include confusion or disorientation, fainting or feeling like you are about to faint, severe or persistent vomiting, severe sinus pain in your face or forehead, glands in the jaw or neck that are severely swollen. Treatment. The common cold cannot be cured, but for symptom relief, try drinking lots of fluids, sucking on ice chips, gargling with warm water with salt in it, using throat sprays or lozenges, resting in bed. Other ideas for symptom relief include taking over-the-counter pain relievers such as acetaminophen, Tylenol, or ibuprofen for a fever or headache, using a saline nasal spray or decongestant, using petroleum jelly on a raw nose. Adults may take aspirin for a headache or fever, but children cannot. Aspirin use by children has been linked to the development of Ray's syndrome, which can cause brain damage and death. Prevention. You can prevent catching a cold or passing it on by following a few simple tips. For example, wash your hands often and keep your hands away from your eyes and nose. Cold viruses on your hands can easily enter through those areas of your body. Avoid close contact with people who have colds. If you have a cold, stay away from others. When you sneeze or cough, cover your nose or mouth with a tissue or by sneezing or coughing into your elbow. This prevents you from getting germs on your hand. You could spread germs on your hand by touching people or objects or by touching your face. Hand washing with soap and water is one of the most effective ways to prevent the spread of the common cold. When water isn't available, use alcohol-based products made for disinfecting your hands. Clean surfaces in your home or place of work with a virus-killing disinfectant.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A cold is a common infection that can be caused by over 200 different viruses. Symptoms often include scratchy throat, runny nose, and sneezing. The common cold is usually mild, but it is one of the leading causes of missed school and work. Symptoms typically last 1 or 2 weeks. Colds often get better within a few days to weeks without medication, but a cold can make it easier for other infections to invade the body, including sinus or ear infections and bronchitis. A common complication of a cold is a sinus infection with a prolonged cough. The common cold cannot be cured, but for symptom relief, try drinking lots of fluids, sucking on ice chips, gargling with warm water with salt in it, using throat sprays or lozenges, resting in bed. You can help prevent the common cold by avoiding sick people, covering your mouth or nose when you sneeze or cough, disinfecting surfaces that may be contaminated, washing your hands often. Thank you for using Explain.